Recently, there's been quite a few studies that have been published over the past few years about smell loss being linked to cognitive decline and maybe even the development of Alzheimer's disease. A lot of this research is correlative in nature, meaning that we can't really prove that smell loss leads to the development of declining brain function or Alzheimer's disease. But what we do know is that a fair amount of large studies have demonstrated that people who have eventually been diagnosed with something like Alzheimer's disease have displayed areas in their brain that have started to atrophy or shrink, and those correlate with those same areas in the brain that detect smells and interpret smells and form memory and are involved in that process. And we can tell that a lot of these patients who develop brain issues later in life also start to display signs of smell loss as one of the first early signs. Now, we don't exactly know if this is directly linked, whether smell loss may be linked to a normal process of aging, or if it might be actually a really helpful clinical marker that we can use to predict whether someone is going to have an onset of Alzheimer's disease or other forms of cognitive decline. But it is one active area of research that we're looking into, and actually looking into various ways that we may be able to not only detect whether there's smell loss early, but also treat smell loss. And there is some evidence so far to demonstrate that treating smell loss with something like olfactory training or other things that can help some of the smell function recover can be helpful for improving cognitive function, such as visual memory tasks and other things. Whether this helps to prevent cognitive decline or helps prevent the development of things like Alzheimer's still has yet to be seen, but again, is an active area of research right now that we're very excited for and something that a lot of researchers are looking into.